I'm Dr. Ken Landau. Thanks for watching. Let's talk about Trelegy. Trelegy, or Trelegy ellipta, is a medicine for chronic obstructive lung disease. It was granted marketing approval by the Food and Drug Administration in September of 2017, manufactured by GSK and Inovia, and it is a drug that's indicated for the treatment of people who have chronic obstructive lung disease that isn't more easily treated with other drugs. It is not a first-choice therapy. It's used for people with chronic bronchitis and with emphysema to decrease the number of exacerbations and to make their breathing easier. It is not for acute bronchospasm, so for people who are worsening, this isn't the drug. And for people who have asthma, it's not the drug. Now, the medicine contains 3 different components. There is 1 steroid and 2 bronchodilators. The steroid, of course, cuts down inflammation, and the bronchodilators act through different mechanisms to open up the smooth muscles so that the air passes into the lungs more readily. Now, one of the bronchodilators, vilanterol, is what we call a long-acting beta agonist. There are different kinds of beta receptors in the body. Some of them are in the heart. So unfortunately, even though this one's supposed to be specific for the lung, it may cause the heart to race and beat more forcefully and change the blood pressure. Well, the medicines are contained in strips. They're inside an inhaler. One strip contains a steroid, and the other strip contains both of the bronchodilators. They're in a plastic inhaler, and there is enough for 1 month, 30 days worth of therapy. It is used once a day, no more. You keep it at room temperature, keep it away from direct heat, away from the sunlight. Once you open the package, it only is useful for 6 weeks. If you open the cover, it will automatically dispense a dose. So if you just are sitting there and you have the twiddles and you open and shut the cover, you're using the medicine even though you're not inhaling it. Well, how do you use it? You open the device, so it's primed now to deliver the medicine. Then you keep the device away from your mouth. You breathe out through your mouth, put the device in your mouth, in your lips, close your lips around the device, don't block the air vents with your finger, take a steady breath through your mouth and hold it for 3 or 4 seconds. Take the device away, you breathe out slowly, you close the device, you rinse your mouth with water, and then you spit the water out, you don't swallow it. You keep track of the counter on the side of the device. It has a counter that goes from 30 down to 0, so obviously when you get down to close to the end, go get another one if it's really the medicine that you need. Now, it's not for treatment of the acute symptoms, not for people who have deteriorating symptoms. It's not for use as a rescue inhaler. You don't use it more than once a day. Don't use it with any other medicine that contains a long-acting bronchodilator, a medicine like salmeterol or formoterol. The combination might be fatal. It causes an increase in the risk of pneumonia, and sometimes people confuse the early symptoms of pneumonia with worsening of the chronic obstructive lung disease. The steroid may predispose to infection with tuberculosis or bacterial pneumonia, viral conditions, parasitic infection, even may cause flares of herpes in the eye or a yeast infection in the mouth or in the pharynx. In some people, there's paradoxical bronchospasm. You breathe it in, it irritates the wind passageways, and they start to constrict. And if you've previously taken a steroid, prednisone, well, the prednisone may shut down your adrenal gland, and the inhaled corticosteroid might not be sufficient to prevent an adrenal crisis if you happen to have some other kind of acute medical event. For instance, a heart attack or an infection, a severe infection, or you go through surgery or have some sort of traumatic event, an automobile accident. And it's possible that the steroid may predispose, the steroid in the inhaler may predispose to osteoporosis, and in some people, cataracts or glaucoma. There's also an issue, especially with the anti-cholinergic capacity of the medicine, for it to worsen symptoms of benign enlargement of the prostate or bladder outlet obstruction. And with some of these medicines, have to be careful because it may predispose in those individuals with convulsive disorder to seizures, or people with elevated thyroid level to thyrotoxicosis. It can increase the blood sugar and decrease the potassium. And if a person is having symptoms, even though the person is using the Trelegy and a rescue inhaler, well, it might be a marker of significant deterioration of the lung disease, and you should see a doctor. The medicine has not been tested in people who are either pregnant or breastfeeding. It's not a medicine for children. And in people with liver disease of moderate to severe intensity, the steroid component may be increased in concentration by threefold. It doesn't seem to have much to do with the bronchodilators. It should not be used in people who have severe sensitivity to milk protein, because it does contain some milk protein, and it also contains lactose, both in the steroid component and the bronchodilator component. And people who are taking either MAO inhibitors or tricyclic antidepressants, medicines like amitriptyline, well, they can have an increase in the effect of vilanterol, the bronchodilator, on the vascular system that can lead to arrhythmias. The side effects of the medicine are upper respiratory infections and pneumonia and bronchitis and yeast in the mouth. Some people get headache or backache or arthralgia, pain in the joint. Some people seem to get sinusitis or pharyngitis or runny nose or diarrhea or constipation or cough. And it can change or predispose the heart in certain ways toward arrhythmias. Now, it can interact with some other kind of medicine, for instance, clarithromycin or erythromycin or ketoconazole, so be careful combining them. And people who have significant COPD have to be extraordinarily careful of taking metoprolol or propranolol or tenormin or Coreg, because they can block the bronchodilating effect of the vilanterol. And people who are taking a diuretic may further lower the potassium. And people who are taking anti-cholinergics may precipitate further kind of problems. Well, the medicine's absorbed, the bronchodilator part, within the first 5 to 15 minutes. The steroid is absorbed within about 30 to 60 minutes. For some reason, there's about a 50% increase in the concentration inside the body in people who are Japanese or Korean or of Chinese heritage. You can overdose on the medicine. You can overdose, especially on the vilanterol. If you do, you get headache and malaise and fatigue and high blood pressure, chest pain, maybe some arrhythmias and nervousness and tremor and muscle cramps. You can get some dizziness, seizures sometime. The treatment for COPD, obviously, it's more than just taking an inhaler. So you should discontinue cigarettes. 50% of the people who have diagnosed COPD continue to smoke. You should get your vaccines, a flu vaccine and pneumonia vaccine. You should go through pulmonary rehabilitation. You should probably not be taking oral steroids for the most part in people who have COPD. That's not thought to be a good idea. And only use oxygen for those people on a regular basis who have severe resting hypoxemia, low levels of oxygen. Then the treatment, the central treatment, is bronchodilators. So bronchodilators are extraordinarily important. The question is, Trelegy that contains the inhaled corticosteroid, is that appropriate or not? And most experts would say, for the overwhelming majority of people who have COPD, no, you don't need an inhaled corticosteroid. Inhaled corticosteroids are pretty much for people who have asthma, not for people who have chronic obstructive lung disease. They have a global consortium that's called the GOLD, the GOLD, Global Initiative for Chronic Obstructive Lung Disease. It's a group formed by the World Health Organization, the National Institutes of Health, National Heart, Lung, and Blood Institute, and they say dual therapy for the most part, triple therapy, the exception to the rule. There were several trials that evaluated the Trelegy. The first couple were 12-week trials looking mostly at men. Half of the people, as I say, are chronic cigarette smokers, continuing cigarette smokers, had a history of about 50 pack years. And looking at the results at the end of the 12-week study, the people had an increase, a small increase in the amount of air that they were able to get out in 1 second. And the amount was about 150 cc's, which is pretty doggone small. Well, then they did another study, and it was a giant study. And the study evaluated about 10,000 people for over a period of about a year. 2/3 of the people were male. They compared Trelegy to Breo. Breo contains the same inhaled corticosteroid and the vilanterol. It just doesn't contain the anti-cholinergic. And then they compared it also to Anoro, which contains the two bronchodilators, the umeclidinium and the vilanterol. So compared those over the course of a year. And what did they find? They found really nothing special, nothing great. They found a smidgen better on the amount of air that the people could get out in 1 second if they took Trelegy compared to the Breo or the Anoro, but it wasn't all that much. And they found a little difference as far as the likelihood of exacerbations were concerned. The mean annual rate was a smidgen less than 1 among the people taking the Trelegy. It was a little over 1 in the people taking the Breo, and a bit more yet in the people taking Anoro. But what does all of that mean? Well, according to the study, it meant that the Trelegy was really great. It was the best of the bunch. But really, there wasn't all that much difference between the groups. And, as we'll discuss in a moment, it seems like all that the Trelegy did was change the time of the curve. So for the first month, there was a difference. And after the first month, seemed to follow the same kind of curve. Now, this very large study was done in a multitude of different countries, 37 different countries, 1,200 different centers. So you tell me how they can standardize anything in such a big study in so many different places, including the Philippines and Mexico and Russia and the Ukraine and Colombia and Peru and the Czech Republic and Brazil, including the usual countries, the United States and all, of course. Well, the report that was in the New England Journal of Medicine caused the editors to write a review, and they said that the evidence supporting the study, the step up to Trelegy, was very weak. And as a matter of fact, it was challenging, according to them, to be able to interpret the study because a lot of the patients were already at the onset of the study receiving inhaled corticosteroids, and then they were stopped. Significant number of the people taking the steroid stopped from taking the steroid, and their study included people who had asthma. So of course they're going to flare. And when you look at the validity of the study, we always look at how hands-off, how blind the studies were, how the drug company was either caught with their fingers in the pie or there were no drug company influences on the study. Well, in this study, there were 15 authors. 8 were employees of GSK, and the rest had the financial support of some degree from the company, one form or another. GSK sponsored the study, funded the study, designed the study, provided the editorial support, and the lead author was an employee of the sponsor. And GSK actually has recently said that they're going to resume paying doctors to promote their medicine, to attend meetings and speak about their drugs, and presumably to get their friends to prescribe the drugs. That reverses a policy that they announced in 2012 when they said they were going to stop paying the doctors. They said they were going to stop paying the doctors by 2016. That's after they paid out $3 billion to the United States government for improperly promoting the drugs for off-label use and for deficiencies in reporting safety data. Well, the company is hurting a little bit. In very recent times, they just lost the patent on Advair. It expired. That drug brought in over $2 billion. Now its revenue is expected to fall by about 30%. So in September of 2018, they started advertising Trelegy to the Jackson 5's hit tune of ABC, and GSK sort of changed that to 1, 2, 3. They think this drug may bring them around $1.5 billion in profit. But they have another competitor, and the competitor is AstraZeneca, another major pharmaceutical corporation. They have another triple therapy using different components. But unfortunately for them, they reported in September of 2018 that the drug met 8 of the 9 goals. The one that it didn't meet, however, was it did not seem to statistically significantly reduce the number of exacerbations or flares of COPD against just 2 drugs. And unfortunately for them, they had just bought the drug for $1 billion. So how do we treat COPD? Well, the way COPD is treated is that you start off with either the one bronchodilator or the other, the LABA, the bronchodilator, or you use the medicines, it's the anti-cholinergic, or you can combine them. Or if necessary, in those people who are rather severe, then the steroid is added. And in some people, you have to add more than that. So in some people, especially in smokers, former smokers hopefully, an antibiotic may be necessary. And in other people, it might be that we have to use a PDE4 inhibitor, a medicine like Daliresp, for people who have chronic bronchitis and an FEV, able to get out less than 50% of the air within the first second. Now, chronic obstructive lung disease is a very common condition. 16 million people in the United States have the diagnosis, and another 16 million have the disease but haven't yet been diagnosed. 120,000 people are going to die of this condition every year, and 10 to 20% of the people who have COPD have never smoked. And only a fraction of the people who do smoke get COPD on a worldwide basis. It's the 4th leading cause of death, and within the next 2 years will be the 3rd leading cause of death, killing 3 million people a year. That's 6% of all deaths. COPD combines dyspnea, shortness of breath. Shortness of breath worsens with exercise. It's persistent. People develop a chronic cough, sometimes recurrent wheezing. The cough can be intermittent or productive or unproductive. And the sputum can be of any pattern. These people can have exacerbations. The way we diagnose it is by examining the amount of air that they can get out, the total quantity of air within 1 second, versus all of the air that's estimated in their lungs. These people typically have chronic diseases, other kinds of chronic diseases. They have cardiovascular disease, maybe they have lung cancer, depression, anxiety, obstructive sleep apnea, maybe they have osteoporosis, and for the most part, COPD comes from cigarette smoking, or smoking cigars or pipes or marijuana. And in some people, it's caused by biomass fuel exposure, indoor air pollution, typically from cooling or heating. Poor ventilation occurs more commonly in women than in men, at least when it's due to the indoor air pollution. Occupational, and more in men than in women, dusts and chemical exposure. Sometimes a person can be primed to develop chronic obstructive lung disease if they have poor lung growth in childhood, maybe because of low birth weight, maybe because of recurrent respiratory infections. Well, there's even more bad news about COPD if we treat it with Trelegy. The cash price for Trelegy ranges between about $625 and more than $700, and with a coupon, it's about $540. However, the company is going to very nicely only charge you about $10 as long as they can soak the insurance company for the rest. These drugs are horribly priced. There is no excuse for the medicines being this expensive. None. So the best to do is to avoid getting COPD in the first place. And for the most part, that means don't smoke cigarettes. And if you do smoke, stop. And if you can't, save your money, because you're going to need it to pay for your medicines, and pray that you're not one of the people who's going to develop COPD, especially the more advanced forms of COPD. And if you have COPD, remember, Trelegy isn't for everyone with COPD. It might be advertised like that, but it really is for a subset of people who have the most advanced disease. And if you have the most advanced disease, guess what? We don't have a great cure. We don't have a great treatment. You're still going to have a downward course. So the best thing you can do is get rid of those cigarettes before they cause you permanent problems. Thanks for watching. I'm Dr. Ken Landau.